just celebrated my 40th anniversary. Well, before I was writing, trying to keep my handwriting neat so I could read it and somebody else could read it. And now it's basically some typing and some just hitting different boxes where the information then comes up on the computer. So first of all, everything is legible. I can go back and read my previous note without difficulty, and anybody could read my note. And time-wise, it's about the same. The only difference is we're getting a lot more information through the computer on the patient history than we did writing it down. And also the nice thing is there are not all these abbreviations that I was doing because I needed to save time when I was writing. And so now I just hit the check area and then everything just prints out that I want to say. So it's easier to enter and it's easier to correct. When I came to work in the office, I let it be known I'm not doing that. And that was my comment. And I was put on an electric pen or some, and I was doing that. I wasn't very happy with it. And then I was doing a little computer work and the electric pen. And I found it very disturbing. And one day, 2 or 3 patients didn't show up. And I turned to the office manager who knew the system very well. And I said, now I'm on the computer. Take this pen away from me. And I'm a person who originally in the old days when we first started getting I first started getting a computer in my house and brought people in to teach me, would get a rash. I'd actually break out in a red blotches on my body being on the computer. And now it's fun. And it's an easy transition. And even if somebody chooses not to do everything, do the changes himself and do everything else himself, just going on there and I sometimes say hitting the buttons makes it very, very satisfying. The other funny part I find is that the patients are enjoying watching me on the computer because obviously I'm not a computer generation person and I'm sitting there and just clicking away. I do have an advantage. I do know how to type from my days in high school, which has come back. But if I didn't, I would just create more customized screens. For me, it's sometimes just easier just to type it in than to go find the spot to click it. So it's a very, very easy transition for a non-computerized person. The big problem in that office is, again, there were multiple doctors, so there are multiple different notes, and there's sometimes some handwriting problems. Also, the notes tend to be short and not as complete as I would like them. The doctor may have done something and may just write down, a very simple note, and it doesn't always tell me what's going on. Here I can always pull up the entire screen and see what happened. It's great because you could put in your diagnoses that you like, and each doctor could have their own series of diagnostic codes that they like. And even if I want to add a code for the day, I keep a code screen next to me and that I've used for many years since I've been doing this for so many years, and I can enter those codes within seconds. And the learning curve of doing all this came very, very quickly, and I'm not a computer person, so I found that being on the computer has everything clearer for me. I can make any changes or modify it to customize it for myself. And as an ENT doctor, it's almost fun, to be honest. I pull up to the computer like I'm a pianist ready to play because I pull my shirt down, I sort of sit myself down because it's so easy to get all the information in. And I'm still working, as I continue to work on the computer, I continue to want to change some of the codes that are in there, and it's a very easy thing to do. And actually in the past I had the staff do it for me, and now I'm beginning to change my diagnostic codes and also my procedure codes to be a little bit more custom to me as against the other doctors who work in the office. The nice thing about Waiting Room Solutions, it's a doctor-oriented program, not a computer-oriented program. It sort of thinks like a doctor thinks. And I think that's why the transition for me was so easy, because it was doing things the way I do it as a physician. You know, I don't worry about toggling, and I don't worry about everything else. As a physician, you're worried about getting patients' history, physical, medication list, getting them coded so your coding can then go on, and getting your plan of treatment.